1 in 5 American adults live with a mental illness across racial backgrounds. During this Minority Mental Health Awareness Month, experts are focusing on bridging that gap.
6 News' Bella Caracta is on your side tonight with how therapists are addressing the problem. She joins us now from the newsroom.
Brian Taylor, the prevalence of mental illness in America doesn't vary much based on race or ethnicity. Minorities, however, do face an uphill battle when addressing mental health.
Being heard is really a big thing, because I know sometimes with the minority population, we're not really heard sometimes.
Samara West is a mental health therapist for the Child Saving Institute.
I think that's really beneficial to have someone understand your background or even your culture.
As a minority herself, she says representation in mental health care helps address barriers like cultural stigma. Another barrier, language. Sabrina Felix is a bilingual mental health therapist.
So I can see that there's like a weight off their shoulders and they're just able to relax and sit down and just go and say whatever they need to say without holding anything back.
According to the Agency for Healthcare Research and Quality, about half of white adults with mental illness receive services, compared to 31% of Black and Hispanics and 22% of Asians. Felix, who also works for the Child Saving Institute, encourages her clients to seek resources to start with a new perspective. On your side in Omaha, Bella Caracta, 6 News.
For those experiencing a mental health crisis, the National Suicide Prevention Lifeline is always available. Just call or text 988.